We are right. Full ischemic time should be less than 1 hour. An invasive carcinoma specimen undergoing head-to testing should be fixed for a duration of 6 to 96 hours. Incorrect.
It should be 6 to 72.
There was no top to 96.
Hmm?
Yes. You know why?
Which of the following it could affect the further testing, like immunohistochemistry, or
Normally,
how?
we don't delay breast cross. All our breast specimens are grossed within 24 hours after fixing. And if they are processed within that time, the processing time is nothing less than 24 to 48 hours. You can't even. So sometimes there was a time I tried to buy time because I was late, but they didn't get it. They didn't listen to my excuse. I had to figure a way. I had to figure a way. So normally you have to watch it very fast. I want to know why. Why can't you exceed 72 hours? Less than 6 hours can result in loss of antigenicity, leading to false negative results.
Because cross-linking of protein.
Masking antigens and also lead to false negative and inconsistent results. So 6 to 72 hours is optimal to preserve tissue morphology and antigen integrity for accurate IHC and fish, especially HER2 fish.
So tissue morphology and antigen integrity for accurate. To preserve tissue morphology and antigen integrity for immunosuppressant hacking.
Okay.
Tissue morphology, if it's less than, that'll be false negative.
Down, there's lots of antigenicity. If it's more than proteins, the cross-link can cover the antigens. The antigens should all be well formed, less than 6 hours. If it's more than 22 hours, more proteins will cross-link and cover up the antigen. So that's why we work very hard to last program to gross breast and make sure and they monitor these things for accredited. You know that our hospital is our lab is CAP accredited. CAP
Okay.
accreditation is very difficult. So these are the things they will monitor when they come for accreditation exercises. I don't think of a single hospital in Nigeria that is CAP accredited.
But you are in America now. You talk of ISO. America is it ISO accredited?
What is ISO?
International Standard Organization.
CAP is bigger than ISO.
How do you know?
Okay.
ISO is for, CAP is an American body. ISO is for lab generally. ISO is accredited for lab generally.
Is your lab ISO accredited?
No, maybe like one or two in Nigeria. Maybe like two. It's less than five. The one and I'm not sure there's any government hospital there.
Let's look at it. Anyway, in Saudi Arabia, I think they had a CAP lab. CAP is organized internationally. It does even goes to Saudi Arabia to accredit. But you know that ISO is more general. CAP is more for pathology. ISO
No,
is
but it's America now. It's America.
ISO.
No, CAP.
Yeah, CAP is more stringent and accuracy and everything. ISO is more comprehensive. So Okay. CAP is technically stricter for clinical laboratory and and test specific requirements. Quality system organization. They are not very good in technical and specifics. All these recommendations, CAP will follow it. Understand? But ASO may just be how you organize yourself. The team is not very huge. What is ASCO, by the way?
I say ISO.
I know ASCO is the American Society of Clinical Oncology.
Okay.
Well, CAP is, I'm sure it's far, maybe bigger than AISO in terms of this thing. I don't think there's any lab in Nigeria that may meet CAP criteria.
Okay.
Okay, I don't have time for that, but let's continue. So we understand why now. So positive status of
Tissue to provide the tissue morphology and antigenicity. In which if it is less than negative because of loss of antigenicity
if it's more than other
is
proteins will cross-link and even cover the antigen
yeah.
that has formed. Antigen will be now, when you fix it, antigens become more fixed for sensitivity and all those things. But when you overfix it, proteins will start cross-linking and like spider web and cover it up. But when you don't do it on time, when it's less than 6 hours, it's not even well fixed. It's not even cross-linked. Okay. No, sorry, it's not even exposed or it's not even formed very well. Positive status of estrogen receptor or progesterone receptor is based. What is a positive ER? What do you mean by positive ER? What percentage of ER is
Positive more than 10%
no,
stain
no,
strongly.
no. Look at it. That's actually a false answer here. So what's the correct answer here?
Greater than 1%.
1% according to CAP ASCO guidelines. So even the 1%, some people will be they'll be treat, these people are looking at what they can use to help the patient. So even if there's a small chance that this 1%, they treat. Okay,
Okay, it's R2 that is 10%.
yes, that's plus one is greater than 10%. For ER, you can equal to 1%. Cold ischemia time. You recommend that the time from tissue removal to fixation should be less than 1 hour to preserve antigenicity for ER, PR, and HER2 testing. HER2, by immunohistochemistry, is considered positive if greater than 1% of the cells show uniform intense membrane staining. True or false? What is considered
It's
positive?
10%. It's false.
10%, perfect. Good. Strong uniform trait, that's 3 plus. 3 plus is a strong positive. Plus 1 is just weakly positive. Abi? What is plus 1 again?
Plus 1 to R2
Mm,
is more than 10% weak membrane positivity.
or plus 1.
Yeah, but more than 10% of the tumors turn positive.
Okay. Hey, this can also show you how to gross all these CAP protocols, but they're actually complex to understand. Even though maybe not complex, but like all these.
Let me see the question.
Let's continue. Let's continue. Let's go to the. So HER2, an invasive carcinoma specimen undergoing estrogen receptor or progesterone receptor testing should be fixed for a duration of 6 to 48 hours in neutral buffered formalin. Correct or incorrect?
Which question are we reading?
The last.
Okay. And this cannot against
What is the answer? It's 6 to 72, not 6 to 48 now, right?
mm.
The A is 6 to 96. E is 6 to 48. What's the correct fixation time for ER and PR?
It's 6 to 7. So
Yeah, very good. Let me quickly review these teaching points. All of our time. Because most of the things we already spent time reviewing the human itself. So let's quickly review these ones. It won't take too much time, but okay, while we're waiting for it to load, next question. What is this? Okay, it has loaded already. By the way, what is this? So are you sleeping?
Yeah, in a way, but
Let-
trying to
let's go and sleep. Let's continue tomorrow. What time can we do tomorrow?
maybe, but those time must be. I can break it into two tomorrow.
What time tomorrow
Maybe
is to be
it's usually today.
8, which is Tuesday for you already.
Hmm?
8 p.m. to 12 a.m.
Yes, that's what he said.
Then 1 a.m. to 5 a.m. So which one? We're gonna do the two or one of them?
It's still going to be like today, but
Eh,
what I'm even thinking is that before that 8 p.m., can we do some session?
Okay, what time do you want a session? Do you want an early morning session?
Not early morning, maybe from 11 a.m. Hey, I'm even going somewhere today. I think it's better. Let's leave it to that from like, okay, 8 to 12. Yeah, something like 8. And we can do it 8. I'll just take a short break. 8 to 12 is okay.
The 8 to 10, then 1 hour break. Then we'll come back 1 to 5.
I'm not sure I'll
It's okay. But
but I will do it to the point.
at
I
least,
think we can still do a little more. Let's do a little more now before
okay.
we stop.
Yeah, yeah.
But we'll now continue by that 8
You
p.m.
know you will not benefit much if you are feeling sleepy. It will affect your quality of comprehension.
No, I think I can cope. Let's do a little.
Okay. According to the ASCO CAP guidelines, the recommended code ischemic time for breast specimen should be what?
Less than 1 hour.
To
B.
ensure optimal antigen preservation. Number two, the appropriate fixative for estrogen receptor, progesterone receptor, and HER2 testing is what?
Still 10% neutral for melanin.
10% neutral buffered formalin.
When do they use bone solution? I think for testis. I don't know.
From Bowie solutions.
Hmm.
Spell it.
Oh, is there doing
Mm.
that BOUIN solution? Or what you can do is copy them and ask when did they use all those substance. It's not only formalin. They put alcohol and
Are you even
can
okay?
you see the other options? What I was like saying is that when did they use the other options, particularly the D?
Okay. These are fixatives.
Mm.
So 100% alcohol is a coagulant fixative, meaning it fixes tissues primarily by precipitating proteins. It rapidly dehydrates the tissue, preserving cytologic details well. Commonly used in cytology, smear preparation, sometimes in frozen section fixation. You know, in frozen section, we usually do sometimes I do hand prepping. Do you do frozen section in Nigeria?
We have done it before our machine spoil.
Wow, you've had a microchip.
Mm-hmm.
Try your start, sorry. Try your start.
Yes, so yes, but it got spoiled at the time. They don't stop doing it.
Wow. So how do they do it? They will call you people that they are ready, right? Or you mean the theater waiting.
They told us they are ready.
You will go there and do it.
I think yes, they take the sample and bring it to our lab.
Okay, you now do it and call them and report to them.
Mm.
Okay. Have you done it before?
No, but there's one consultant that does it, one professor.
Okay. Okay.
So who does it in your place? Is it resident or consultant?
Residents. The one that do
Eh?
the resident in the technical aspect. The consultant does the interpretation. So they will assign it with the consultant. So when you have frozen section, you'll be the one to do the technical work. You prepare the specimen, cut it, freeze it, section it, give it to your consultant to look under the microscope. They will now call the people, and you have to report within 20 minutes. You will now call them and say margins positive, margins negative, tumor present, tumor absent, all the kind of things.
Okay.
Tumor dysplasia present, 5 millimeters from margin, 2 millimeters from margin, all kind of things.
Okay.
And in fact, as when I got to PGY2, toward the end of PGY2, some consultants even began to allow me to call clinicians to do the interpretation myself and call clinicians. So it's something that is so routine. It's amazing that it's a professor that that does it. It's like even non-doctors, the pathology assistant, they used to help with technical aspects of it. Anyway, it's money problem.
No. They help with technical aspects. The lab scientists help with the technical. You understand? I'm saying it's one professor that actually usually interprets it.
Yeah, they don't even help us. So, don't worry. So, when we start our own teaching hospital, by God's grace, we'll be doing frozen section pure. I mean, we don't need no, it will be so routine. So, detailed explanation of each option. 100% ethanol. So it's used to frozen section. Pathology use not suitable for standard tissue fixation, biopsy fixation. It causes shrinkage artifact, poor preservation of tissue technique, architecture. Proteins may be denatured in ways that interfere with IHC and fluorescence in rehabilitation. So normally, tissues that we use for frozen section, we don't use it for permanent. We usually preserve some tissues for permanent sections. That's the one we use for IHC. Those ones, so frozen section may affect IHC. Let's come to 10% buffered formalin. It's formaldehyde fixative. That's 4% aldehyde in a phosphate buffer 7.0. Neutral buffer. Neutral buffer prevents the tissue from becoming excessively acidic or basic, which can cause degradation or artifact. Pathology use the gold standard for histopathology for routine H&E, IHC, essential for receptor testing like AR, PR, HER2, molecular assays like FISH, HER2 gene amplification. It preserves antigenicity optimally. 6 to 72 hours is the reliable timing. Acetone. It's a precipitating fixative like ethanol. It works by dehydration and protein precipitation, often used for frozen sexual fixation because it acts very rapidly. We don't use it. We use alcohol in that place. No, we don't use alcohol. Alcohol is just to keep our tissue before we start frozen section. Actually, we use xylene. We use, first of all, we put it in hematoxylin. After that, we do some bluing. After that, we wash it off with water. After that, we put it in EOC. After that, we do some, put it in xylene, and that's all. Then we now to cover sleeping. I can cut tissue with microtome. But that's for frozen. I use frozen section microtome anyway to learn. I'm not cut on it and each slice. Can you cut tissue from with microtome?
Okay. No, in the lab scientist, so I didn't really have times to, what can I say now, to do for the hands-on.
Come on, we don't do it. It's only frozen section that we cut. But if you can cut frozen section, I believe you can also cut. You will able to cut this one too. Pathology use fixative for frozen sections and cytological smears. Used for when rapid diagnosis is needed intraoperatively. Reserves enzyme for histochemical stains. Bowen solution. Antigen retrieval becomes difficult in people with acetone. Bowen solution, it contains picric acid, formaldehyde, and acetic acid. Three things: picric acid, formaldehyde, and acetic acid. Excellent for morphological detail, particularly in you are right, testicular biopsies and gastrointestinal specimens. Do you normally use it in Nigeria?
I think some people have used it before, but we not routinely in our life.
Good for preserving delicate tissue structure, used in some special stains and in tissues where morphological details is critical. Proverbs vivid staining results due to picric acid components. Um, it alters protein structure significantly due to strong acid content. It makes antigen retrieval complex and unreliable. Causes cellular discoloration of tissues, generally incompatible with standard IHC protocol for resource testing. That's why we don't use Bowen solution. So the one that is good for ERPR for IHC testing is only 10% neutral buffered formalin. It has optimal antigen preservation. So it must not be
Okay.
like that. Okay, we are doing about this. Okay, good. Let me see. Bowen solution. Bowen solution. Test histology. Make you look at a picture of it. Does it look like H&E? Have you read any tissue that was prepared with Bowie solution?
No.
Bowie fixative. Bowie fixative. Okay. Let's go back to H&E. Okay. The acceptable fixation time for H2 testing is 6 to 72 hours, right? Hello?
Hello.
You slept off again? After this one, definitely we are going to sleep. I don't want you to miss DCIS. But the next question is DCIS. If you miss it, that will not be good. It will affect, it will not be good. Because it's a bread and butter something. So we'll do it tomorrow. The acceptable
Okay.
fixation testing is 6 to 72 hours.
Which question are you number are you now?
So number 3,
It's 6 to 72. Okay.
a positive HER2 result by immunohistochemistry is defined as what?
Greater than 10% uniform intense membrane staining. That's
Meaning beautiful. Greater than 10% intense membrane staining. Can we tomorrow? What about 11 a.m.? Will you be free?
okay. It's today. Oh. I have to be somewhere.
Okay,
Oh,
let's leave it there. Um,
okay, that's true.
okay. Positive estrogen receptor status is defined as what?
What is it actually said by it is verse still greater than 1%. Eh?
There's 1% of the cells. HER2 by fish is considered amplified. What do you this thing we saw it yesterday. You see, we didn't study it much, but it came back to us again. Copy gene number.
By 50. If and 17 ratio is greater than 2 and 2 copy greater than 4.
Yeah, there's also called HER2 copy number. That's what that now let's quickly look at this again for the last time. Because last yesterday we saw it and we kind of skipped over it. Now it's becoming like frog, asking me when you ask Mr. Frog, why is it they don't have a tail? He said, let's jump over that matter. So let's so HER2 is also called human epidermal growth factor receptor 2. What's the full meaning of the acronym?
Human epidermal growth factor receptor 2 are 2 new.
Yeah, it's a gene that plays a key role in development of breast cancer and some other cancers. By expression of amplification of HER2 is associated with aggressive tumor behavior and influences treatment options. Two targeted therapies like trastuzumab. FISH is a laboratory technique used to detect and localize the presence or absence of specific DNA sequences on chromosomes. So, in the case of HER2 testing, FISH helps to evaluate whether the HER2 gene is amplified. So, when the HER2 gene is amplified, that's when it expresses a protein. Remember gene expression. When we do IHC, it's the protein we pick up in IHC. Okay, so but in the FISH, we go and look for the gene itself to see if it's amplified or not. Important terms. We have HER2 SEP17 ratio. This is the ratio of the number of HER2 gene signals to the number of centromere 17 signals. Centromere 17 serves as a control to normalize for chromosome 17 variants. HER2 copy number. The average number of HER2 gene copies per cell. So you can easily look at the average number of HER2 gene copies per cell, or the ratio of HER2 to centromere 17. I don't understand it,
Ratio. Mm.
but let's look at it. So A, a HER2 centromere 17 signal ratio greater than 2 shows that HER2 genes are disproportionately increased compared to the centromere control. So I think HER2 is located on chromosome 17, I guess. So and the centromeres are, are equivalent to the number of HER2 genes there. So if the HER2 genes are more, greater than 2 times or equal to 2 times the size of the centromere 17, they are disproportionately increased compared to the centromere control. HER2 copy number equals to greater than or equal to 4 per cell shows that the absolute number of HER2 gene copies is meaningfully high. If the ratio is high, but the copy number is low, it suggests possible chromosome 17 loss or technical artifacts, not true amplification. So sometimes we compare the two. If the ratio is low and the copy number is low, there's no amplification. So for you to say there's amplification, you have to say the HER2 SEP17 ratio greater than or equal to 2 and the HER2 copy number greater than or equal to 4. If HER2 signal is present, it does not necessarily mean amplification. Normal cells have 2 copies of HER2. So, sir, how many copies of HER2 gene does a normal cell have in chromosome 17?
2?
2 copies. If the copies increase to 4, what do we call that? That's the HER2 copy number equals to 4. And at what threshold will you say that's amplified for absolute counts?
If the ratio is greater than 2,
That ratio in terms of absolute number of HER2 gene copies now.
if it's greater than 4,
greater than or equal to 4. Greater than or equal to 4. Or, there are two ways. Greater than or equal to 4. Greater than or equal to 4. We for her two copy number. So the two copy number, absolute copy number greater than or equal to 4. It's need to be amplified. Okay. So are you with me? Why in terms of
Okay.
ratio? In terms of ratio, her 2 17 ratio greater than or equal to 2 is also said to be amplified. But now let's compare the two. What if there's discrepancy? What if the ratio is increased, but the absolute copy number is low? What does it mean? Maybe an artifact or one of the chromosome 17s is lost.
Okay.
What are chromosome 17? If both of them are present, they should not have more than 3 2. So ratio may be high and copy number is low because one of the chromosome 17 is lost. If the copy number is high, like 4, but the ratio is normal, what does it mean? I don't really know.
Hello.
Um,
If the ratio is low, copy low, no application. If the ratio is high but the copy low, it suggests chromosome 17 loss or
yeah,
technical activity path.
yeah. Now, HER2 signal is present in all normal human beings, but the problem is it amplified? It's greater than 4 absolute counts in chromosome 17. That's amplified. HER2 copy number high, HER2 17 greater than or equal to 2. Both of them is gene amplification. So, the diagnosis of HER2 gene amplification requires what is the criteria for amplification for HER2?
Criteria for amplification.
Yes, for
Yeah,
HER2.
and the ratio must be
You
greater
must
than
you
2.
must have both, you must report both HER2 17 ratio and HER2 copy number. Both of them must be reported together for you to determine if there's amplification or not. Okay, sir. Are you with me?
Yes.
You cannot use copy number alone to report it. There must be both HER2 17 ratio high and HER2 copy number high for you to call it amplification. And what is the criteria?
Greater than 4. The ratio must be greater than 4.
No, no,
I,
no. You have to tell us what ratio and what the number is.
I didn't get the question.
What is the criteria for HER2 new amplification by fish? Yeah,
No, I don't know.
is it on the board now? Can I read it?
Sorry. Is it this ampli? Okay. Can everything. I just increase compared to the ratio is high, the number is low, so deposit is so loss. If ratio is low and copy number is low, there's no application. If any are to this person, it does not mean application number say have to copy. Thus, the diagnosis of application require both a ratio and a sufficient copy number. So by fish, where is that one?
The fish is what is fish that will tell you the results now. It's fish that will fish is
Okay, okay.
as both HER2 17 ratio and HER2 copy number. You understand?
Yeah.
So if you want to say H2 amplification, remember, when do you send for fish? When do you send for fish?
When there is ambiguity let's see, in IOC at
With
2 plus
2 plus.
ambiguity, yeah.
2 plus. Very, very good. That's when you send for fish. And then how is fish reported? As either amplified or not amplified, right? Hello? Hello?
Hello?
Fish is normally reported as fish amplified, head 2 amplified, head 2 not amplified, right? So to call
Yeah.
it amplified, there must be 2 criteria to call it amplified. Head 2 sub-17 ratio must be greater than or equal to 2, and the head 2 copy number must be greater than or equal to 4. If both of them are low, what is that? Not no amplification. If both of them are high, what is that? Amplification. And then you go ahead and treat the person with trastuzumab. Okay. And then, but if there's discrepancy, there's an artifact. We're almost done. Two immunohistochemistry 2 plus is considered equivocal. An equivocal fish result from HER2, result for HER2 is characterized by equivocal fish is characterized by what? HER2 cell, no, HER2 cell less than 2, it's a 2 copy number 4 to 6. Yes. When there's discrepancy, that's equivocal fish results. Example
I
is
think
option.
Jonah,
Yes.
I agree with you. You can
Yes, let me leave you. You can leave.
continue.
Oh, okay, let's continue tomorrow. Okay,
uh, so
thank you.
what I want to say it's 3 o'clock now. It's today, not even tomorrow. It's
So
possible. What we could do if you have the time, we could do from like 4 to 6 p.m. Take 2 hours break from 6 to 8. Then I remove from like 8 to 12.
again, I didn't get that.
No, we plan to meet 8 to 12. So
Yeah.
I say that we could meet 4 to 6 p.m. and then take 2 hours break and then now meet by
Okay.
that 8 that we plan to meet
4
from.
to 6. 4 to 6 will be what time? For me, that will be 11 to 1. Okay. 11 to 1. 4 to 6. No. 11 to 1. Then 8 p.m. will be 3 years. You're right. 11 to 1. Okay, we can try that tomorrow.
Okay,
Thank you. We'll continue from here tomorrow.
you're welcome. Bye.
Goodbye, sir.